Good afternoon. My name is Eva-Maria. Thank you for the opportunity to present some part of the data from our study, in which we did a pre-post evaluation of the emotions and motivations for transformative action of medical students in different planetary health educational interventions at our medical school in Würzburg, Germany. We have to take into consideration that the majority of the generation of the students we teach is already well informed and already alarmed about the climate and ecological crises. So we asked ourselves, when we teach them about planetary health topics and give them more information about the dangerous situation we are facing, what happens to them through our teaching? The study questions therefore were, what are the emotions of our medical students about climate change before they hear about planetary health in class? And how does our planetary health education affect their emotions and motivation to act? We looked at two different of our teaching interventions at our medical school for this study. One is the lecture Planetary Health. This consists of 3 teaching units and is offered for students of the 5th semester. The other is an optional course or elective Planetary Health, which consists of 30 teaching units across an entire semester and is open for students from the 2nd to the 9th semester. We offered both of these in the same way during 4 consecutive semesters, 21 to 23. The lecture is an interactive online lecture with an introduction into the main topics of planetary health, but also focuses on options for action for health professionals and is offered for all students of the entire semester, even though there is no compulsory attendance. The optional course with 30 units allows more time for in-depth exploration of the topics and additionally includes aspects of gender, climate justice, economics, and gives an introduction to project management. After a 3-day initial course, the students work on concrete projects in small groups and present the results at the end of the semester. 16 students participated per semester. In all cohorts, we did an anonymous online survey at the beginning and at the end of the teaching intervention on own devices directly in class. Today, I would like to present results of 2 questions. Firstly, we asked the students how strongly they felt 12 emotions when they think about climate change. We took this methodology from a different study. We also asked students how, in their opinion, planetary health education can lead to more motivation to act. Here you can see the numbers of the students who participated in the educational interventions and in the survey. The response rate was fairly high as the survey was filled in directly in class. The rate of female participants is only slightly higher than the, in general, much higher number of female medical students in Germany. 11% of the students in the lecture declared they are already acting against climate change, and 21% of the students in the course. Here you can see data of the students of the lecture regarding their emotions towards climate change in so-called violin plots. The top end means they fully agree, and the bottom end means they do not agree at all. You can see they mostly agreed to experience the emotions fear, disappointment, helplessness, and anger, as indicated by the dark line as the median, and the dotted line as the mean. When we asked after the lecture, 4 of the emotions showed significant changes. These were disappointment and helplessness, which significantly decreased, while motivation to act and confidence significantly increased. When we look at the Cohen's d as a measure for the effect size, it becomes evident that it is higher for motivation to act and confidence. When we look at data of the students of the optional course, we can see that it doesn't differ much from those of the students of the lecture. Interestingly, the same emotions show significant changes in the pre-post comparison. These are disappointment, helplessness, motivation to act, and confidence. Only here, the decrease of helplessness and the increase in confidence shows the biggest effect sizes. When we ask the students how planetary health education can lead to more motivation to act, which we consider a necessary outcome of any planetary health intervention, we received 49 free text answers, which we analyzed qualitatively according to Kuchartz. It became evident that students demand concrete options for action and would like educators to promote confidence. Also, planetary health topics should be part of the mandatory curriculum and should include practical skills. The displayed quotes underscore this. I'm coming to my conclusion and take-home messages. Firstly, existing emotions and associated challenges of the students need to be taken into consideration when designing and conducting planetary health educational interventions. In other words, no more doom talk. Secondly, planetary health education should focus on options for action regarding knowledge and competencies and aim at building also emotional resilience and confidence. Lastly, increased confidence and motivation for action can be achieved even in short educational interventions like single lectures, if there is a focus on option for action and wording is used to empower the students. Thank you very much. I'm happy to receive your questions.